Hi, my name's Kristen, and I'm going to be your nurse today. And today we're going to be doing a full head-to-toe assessment on you. Do you have any allergies?
No.
How tall are you?
6 foot.
Okay, can you step up on the scale for me? So you're 199 pounds, and you're 72 inches. So on this BMI chart, you are, your BMI is 27. So that puts you in the overweight category. So just keep your nutrients at bay and follow up with your doctor on that. Alright, so now we're going to test cranial nerve 2. We're going to do the Snellen chart to test your visual acuity. So I'm going to have you get up and stand over here for me. Alright, so cover one eye. Read the lowest clear sign you can read.
D-E-F-P-O-T-E-C.
Okay, so that means that your visual acuity in your left eye is 20/20, so change eyes.
L-E-F-O-D-P-C-T.
Okay, and your visual acuity in your right eye is 20/15, and that is checking cranial nerve 2. So can you tell me what colors you see there?
On top I see green, on bottom I see red.
Okay, so that's great. That means you have passed your colorblind assessment. So come back and have a seat on the bed for me. Do you know who I am?
My nurse, Kristen,
Okay, do you know where you're at?
at the hospital.
Okay, do you know what the date is today?
July 9th, 2018.
Okay, do you know what day of the week it is?
Monday.
Do you know who the president is?
Donald Trump.
And do you know who the vice president is?
Michael Pence.
Okay, great job. So now I'm going to check your head and neck while you're in the sitting position. So just taking a look, your skin is dry, it's intact, it's a little tan. Not much redness, a little red, but everything is symmetrical. You have good musculoskeletal development in the face. Your scalp is not drooping or flattened at all. So now I'm just going to feel of your scalp. Is there any tenderness?
No.
Okay, and it's not flat, it's firm as it should be. There's no critters running through your hair, there's no flaking, your hair is blonde, it's evenly distributed, and so that looks good. So now I'm going to feel your facial bones. Is there any tenderness in your facial bones?
No.
Alright, so now I'm going to percuss your sinuses. And there's resonance heard throughout. And now I'm going to test your temporomandibular joint, so I'm going to have you open and close your mouth. And there's no popping noted, so there's no crepitation in your temporomandibular joint. So now we're going to assess cranial nerve 5, 6, and 7. So can you close your eyes? Can you wrinkle your forehead? Alright, can you smile for me? Can you clench your teeth? Can you stick out your tongue? And can you puff your cheeks out to assess cranial nerve 5, 6, and 7? Okay, great job. So now we're going to assess light touch sensitivity. So I'm going to have you close your eyes. I'm going to touch you with a dull or sharp side on your body, and you're going to tell me where I'm touching and if it's dull or sharp.
Dull. Left arm.
Okay.
Sharp. Right arm.
Okay, great job. So now we're going to just take a look at your eyes. So they're symmetrical. They line up with your ears, as they should be. There's nothing uneven or not bilateral that I'd be concerned about. Your hair is evenly distributed on your eyebrows. Your eyes line up symmetrical with your eyebrows. And you have good eyelash distribution. It's not like you're missing eyelashes or anything to be concerned about. The skin is pink and intact. So now I'm going to palpate your eyelids, and your palpable folds, and your lacrimal ducts. Is there any tenderness?
No.
Okay. Now I'm going to put some gloves on. We're going to look at your conjunctiva, your sclera, and your iris. I'm just going to pull down. And your conjunctiva is pink and moist, your sclera is white, and your iris is brown on the right side. And on the left side, Your conjunctiva is pink and moist, your sclera is white, and your iris is brown as well. So that looks healthy and intact. Alright. So now we're going to assess cranial nerve 2 again with the Rosenbaum chart. So I'm going to have you read the lowest line that you can and hold it about 15 to 16 inches away.
We sometimes take long walks together if it is warm outside.
Okay. So your near vision acuity is 20/40 in both eyes. And that is cranial nerve 2, once again. So now I'm just going to take a look at your, alright, can you follow my finger? Okay. And just look straight ahead. Alright, just look straight ahead over my shoulder. Alright, and so your eyes accommodate to light and object, which is good. You have good extraocular eye movements. Nothing to be concerned about there. Now I'm just going to take a look at your corneal reflex. Good corneal reflexes. So cover one eye for me. Look straight ahead. Okay. Cover the other eye.
Oh.
Alright, and there's no, not seeing anything that doesn't look right. There's a curtain like there should be. There's no glaring on the cover-uncover test. And now I'm just going to check the red reflex test. Okay, so just look straight ahead. And there's a red reflex as there should be. So that's normal. Now I'm going to check cranial nerve 3, 4, and 6 with your extraocular eye movement, so just follow my finger. Okay, great job. And now we're gonna move to the other side, and I'm gonna check cranial nerve 2, your peripheral vision. So just tell me when you see my fingers.
See 'em.
Okay, good job. Now we're gonna check your corneal reflex test. So that's cranial nerve 5. I've pulled the cotton out on the Q-tip. And so you're just going to react. You're going to look straight ahead. This is going to kind of come at your eye, and you're going to react appropriately. Okay? You definitely don't want that to touch your eyeball. So you have good reflexes. So now we're going to take a look at your ears. Let's look at your nose first. We'll take a look at your nose. So it's symmetrical, it's in line, the skin is pink and intact, as it should be. Your septum is a little deviated to the right. That's okay. So close one side off for me. Okay? Breathe in, breathe out. Do the same for the other side. Okay? So you have good airway patency. So now I'm just going to take a look in your nose. Cap on. Okay. And your mucosa, carbonates, and septum are pink, dry, moist, and intact. Well, they're pink, moist, and intact. Now we're going to check cranial nerve 1. Alright, so close your eyes. Can you tell me what you smell?
Vanilla.
Okay, good job.
Garlic.
Yes. So good job on both of those. Now we're going to take a look at your ears. So they're symmetrical bilaterally. They are right in line with your eyes. Let me palpate the auricles. Is there any tenderness?
No.
Okay. There's no crusting. There's no redness. There's no swelling noted on the outside. So now we're going to do the whisper test, which is cranial nerve 8. So I'm going to whisper behind you, and you're going to tell me what I say, okay?
Cat. Dog.
Okay, so you can hear when I whisper. There's nothing to be concerned about there. Now I'm going to take a look inside your ears. Okay, so I'm going to hold this like this. Do some leverage in between. Hold down and back and look inside your ear. Alright, I don't see any wax. There's no inflammation. There's no drainage. Your tympanic membrane is pearly gray. Everything looks clean, clear, and intact. We're going to look on this side. Is there any pain?
No.
Okay, your tympanic membrane is pearly gray, and it's clean and intact. There's no earwax, no drainage, no redness, nothing to be concerned about. Now we're going to perform the Weber and the Rhine test to test your sensorineural and conductive hearing loss. So we'll do the Weber first, and you're going to tell me if there's a difference in each ear or if it's equal. Okay, so there's no sign of any hearing loss. If you can hear it both in the same in each ear. If you were hearing better in another ear, there would be a concern. And now we're going to do the Rene test. I'm going to place this on your mastoid bone and then bring it to the front, and you're going to tell me which one you hear better in and longer. You still hear it?
It's longer than front.
Okay. Good. Let's check the other side. What about this
Longer
side?
in the front.
Okay, good deal. So that finishes up the ear exam. And we've already done the nose, so we're going to move on to the mouth. So we're just going to take a look on the outside. Your lips are symmetrical and even. There's no scarring on your mouth or anything. So now I'm just going to take a look inside. Alright, let me see. Open it. Okay, so your gums are pink and moist and intact. Your mucosa is pink and moist and intact. Your hard and soft palates are noted. There are no tonsils because you had those removed, so move your tongue up for me. Your veins move down to the floor of the mouth. The floor of the mouth is intact with pink, moist, and dry mucosa. Let me see back there. I just need you to, there you go. Your anterior and posterior pillars are noted. Posterior pharynx is noted and intact. 37 teeth. They're pearly white. They look like they've been well taken care of. There's no mouth odor noted. Can you stick your tongue out for me? Like, all the way. Okay, it's symmetrical to the midline. There's no asymmetry. I'm not worried about like a stroke or anything. Can you move it side to side? Can you like move it around? You give movement of your tongue, good tongue mobility. So now we're going to test cranial nerve 10, and that's your gag reflex. And I know you hate this. So you have a normal gag reflex, even though you don't want to be gagged. That's fine and normal. Now we're going to test cranial nerve 7 and 9. And you're going to close your eyes. I'm going to rub a taste on the side of your mouth, and or the side of your tongue, and you're going to tell me what you taste, okay? Stick your tongue out. That was cranial number 7 and 9. So now we're going to take a look at your neck. And so, just looking, everything is symmetrical. It's smooth. You have good musculoskeletal development. There's no scarring noted. Nothing to be concerned about. Your skin matches the rest of your body. Your trachea is at midline. I can feel it right here. Everything looks good. You're going to feel for your carotids. All right, you have a bounding pulse of 2+. On each side, bilaterally. Now I'm going to go to the back side and feel for your thyroid. So I'm going to have you turn your head to the right. Swallow. Okay. Turn your head to the left. Swallow. Okay. I don't feel a thyroid. I don't feel any problems that I would be concerned about. There's no goiters. Nothing that would lead me to think that you have a thyroid problem. Alright, so can you move your head forward? Side to side. Against my hand. So you have good resistance. Can you just move your neck around? You have good range of motion in the neck. I would give it a 5 out of 5 on muscle strength. Let's listen to your carotids and your thyroid. Alright, and there's no bruise heard with your carotid arteries or your thyroid. Then I'm going to check your jugular vein dissension in the abdominal assessment. I'll have you laying down, so I need you at a 30-degree angle. So now I need you to shrug your shoulders to test cranial nerve 11. Okay, so we're done. Alright, you have good shoulder movement. You can shrug your shoulders as you should be able to. Now I'm going to feel for lymph nodes. So, preauricular, postauricular, occipital, tonsillar, submandibular, submental, superior cervical chain, posterior cervical chain, supraclavicular, and infraclavicular. And there are no nodes noted, which is good. It just calls for alarm if you could feel nodes. So now we're going to take a look at your upper extremities. So can you move your wrists, your forearms, your upper arms, your shoulders, move your fingers around. Okay, so the skin on all of it is clean and intact. It matches the rest of your body. There's no scarring noted. You have good range of motion in your shoulders, forearms, upper arms, wrists, fingers. Okay, so can you push against me? Check your muscle resistance. Okay, and you have 5 out of 5 strength with muscle movement. No concern with that. So now I'm going to check your radial pulse. Alright, so your radial pulses are 2+. Your brachial pulses are 2+, and there's no epitrochlear node noted, which is good. You don't ever really want nodes noted. Alright, so now we're going to take a look at your chest. So, just looking at your chest, I'm just going to look. You have good thoracic configuration, good posture, good musculoskeletal development. Your skin is the same color. There's nothing I'm concerned about. No moles, no scarring, nothing that causes any immediate alarm. You have good respiratory effort. You're not struggling to breathe. There's no pulsations or heaving. So now I'm just going to press on it. Kind of palpate it. Is there any tenderness?
No.
There's no crepitation noted. You have good chest wall stability. Yeah, there's no tenderness, no crepitation, and you have good chest wall stability. It doesn't move when you press on it, so I'm not really concerned about respiratory disorders. So now I'm going to palpate your precordium. There's no thrills, heaving, or pulsations noted. Okay. So now we're gonna check for tactile firmitis. Say 99.
99.
99.
99.
99.
99.
All right, and vibrations are heard throughout. Now I'm gonna palpate for axillary nodes. I don't feel any axillary nodes noted. So I'm going to go ahead and percuss the chest wall, which would normally be on your skin. There's resonance heard throughout. Now I'm going to listen to your breath sounds. Breathe in and out. Breathe in and out. And this would normally be on your skin. But... Okay, and again. All right, and your lung sounds are clear. Now I'm going to listen to your heart sounds, starting with aortic, pulmonic, Erb's point, and apical. And that is clear as well. At this point, we're going to defer the breast exam because we don't want to expose you. So we're not going to check on those today. Now I'm going to go around to your backside and look at your chest. Your shoulders are even bilaterally. There's no moles or scarring on the backside either. You have good musculoskeletal development, good thoracic configuration. There's no slumping noted. So now I'm going to palpate your scapula and your spine. Is there any tenderness?
No.
All right, so I'm going to have you like sit forward and kind of hold your elbows. I'm going to percuss your spine. And there's resonance heard throughout. So now we're going to palpate your costovertebral angle, your CVA tenderness. Is there any tenderness?
No.
Now we're going to percuss it. There's resonance heard throughout, but no tenderness. So just looking at your respiratory rate on the back, there's a good excursion, rate, rhythm, depth, pattern. It's easy and unlabored. You're not in any respiratory distress right now, which is always good. So now I'm going to palpate for tactile firmitis. So say 99.
99.
99.
99.
99.
99.
Okay. And I can feel vibrations throughout. So now I'm going to have you deep breathe, and we're going to check for chest wall expansion. So breathe in. And my thumbs move apart as they should. Now I'm going to palpate your lateral walls and your posterior chest. Is there any tenderness?
No.
Okay. Now I'm going to percuss the lateral walls. And the posterior chest. And there's resonance heard throughout. Your lateral walls and your posterior chest. And now we're going to take a listen to your breath sounds on the back side. Breathe in. Okay. Okay, so all your chest sounds are clear, or your lung sounds are clear. There's no adventitious breath sounds heard. Everything sounds appropriate. I'm going to have you lay down and we're going to take a look at your belly. Alright, so kind of lay your head back like this. So I don't see any jugular vein distension. This would be at a 30-degree angle, typically. but nothing's protruding. I don't have any like concern there. Do you have any cardiac deficits? So now we're gonna take a look at your belly. So I'm gonna look at it. All right, your skin is white. There's a couple scars from probably like an appendectomy. Nothing major. They've healed great. There's no color deformities or anything that I would see. Now we're gonna listen. Vowel sounds are normoactive. Now we're going to percuss. There's resonance throughout. Now I'm going to lightly palpate. Is there any tenderness? And now I'm going to deeply palpate. Any tenderness? Alright, and your belly doesn't feel distended or anything. It's not hard. Now I'm going to palpate for abdominal lymph nodes. There are none felt. There are no hernias felt. We're going to take the reflex hammer and check your abdominal reflexes. And your stomach kind of moves in as it should, like when something touches you. And I'm going to have you do a crunch. You have good muscle development. You can hold yourself up. There's no wasting or anything. And now I'm going to check your femoral pulses. I know you hate that. All right. They are 2+. So now we're going to take a look at your legs. So just looking at your legs, they're tan. You have about a 2-inch scar on your left leg, probably from a prior accident, but it's healed nicely. Your feet are the same color as your legs. Now we're going to palpate. There's no masses or anything noted. Your feet are cool to touch. There's no masses noted in your feet. Now I'm going to, can you raise your legs? Okay. You can raise against like a strength. And can you put your feet down like you're on a gas pedal? All right. You have good muscle development, good range of motion in your feet. Now I'm going to check your pulses. So your popliteal pulses are 2+. Bilaterally. Your posterior tibia is 2+. And dorsalis pedis is also 2+, as it should be. So now we're going to check the range of motion in your hip. So I'm going to bring your knee to your chest. Bring it out toward me. Bring it over. And bring it down. Okay. There's no crepitation or popping in your hip. You have good range of motion in your right hip. So let's check your left hip. All right. We'll do the same. Over. Down. There's no popping in your left hip either. No crepitation noted. So now I'm going to check your plantar reflex. I'm just going to kind of hold it. Does it tickle?
Mm-hmm.
Okay. So your toes curl as they should. You kind of go against that tickle motion. You don't want it to happen. And that's fine. So I'm going to have you sit to the side of the bed for me. Okay. You have good muscle control. You have good coordination when going from a lying to sitting position. Are you dizzy at all?
No.
Okay. That's good. So now I'm going to check your deep tendon reflexes. We're going to do your patellar. All right. And they're not overreactive or underreactive. They're normoreactive. And then your dorsal. You have 2+ strength there as well. I mean, like 5 out of 5 reflexes. They react as they should. So now I'm going to have you kind of do like this. Okay? Kind of move you good fine motor control. Now we're going to do the sensitivity again. You're going to tell me if it's dull or sharp and where I'm touching.
Sharp left arm.
Okay.
Dull right wrist.
Okay. Good job. And now we've already done the plantar reflex, so I'm not going to do that again. So now I'm going to have you come to a standing position. Okay. Can you turn around so we can look at your spine? We'll kind of turn this way. We'll look at your spine. There's nothing to be concerned about. It's symmetrical. So now I'm going to have you touch your toes. There's no scoliosis noted with your feet together. All right, come back up and turn back around and face the camera. Can you bend backwards, forward, side to side? Okay, so you have good range of motion in your spine. So I'm going to have you keep your hands at your side, close your eyes. We're going to do the Romberg test. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You had a slight sway there in the middle, but nothing to be overly concerned about. You still kept your proprioception. You knew where you're at. So I'm going to have you walk for me. Walk normally. Your gait is easy. You have no difficulty walking. Can you walk heel to toe? Okay. You have no difficulty walking heel to toe. Can you duck walk for me? You have no trouble with that or following commands or anything. Now walk back. All right. Can you stand on one foot? Okay. You can stand on one foot. Can you hop on one foot? And we're going to not make you hop on the left foot since you have an injury and you're not supposed to hop on that foot. And then I'm going to have you bend at the knees. And there's a little popping noted, but otherwise, you seem to be pretty healthy overall, and that concludes our health assessment.